Welcome back. President Trump was in New Hampshire today to talk about his plan to fight the nation's opioid crisis. Now, we know states like Maryland and Pennsylvania actually declared states of emergency on the local level to help in their efforts. But the president's plan today goes as far as to hint at the death penalty for certain violators. But really, how should we be handling the crisis? Ames Grawert, senior counsel for the Brennan Center for Justice, up late with me on the Final Five to talk about this and more. Ames, they say desperate times calls for desperate measures. When we talk about the death penalty, that's pretty drastic.
It is, and desperate times do call for desperate measures, but they don't call for ineffective ones. There's no evidence that the death penalty actually works to deter crime. It's just a quirk of human behavior. People don't think that it'll happen to them. People don't think that the consequences will apply to them. And so people aren't deterred by something like the death penalty. And we've found in our own research, people aren't deterred by overly long mandatory minimum sentences either. The better way to handle it, and some people certainly do deserve criminal punishment, is shorter sentences tailored to their conduct that they know are likely to befall them. Short, sharp, swift is the sort of criminological lingo.
We know the president coming into office, I mean, he did address the opioid crisis on the trail. He went to New Hampshire a couple times and brought it up. I mean, I think we all could agree it's a terrible situation we find ourselves in. And there are so many different factors out there, but it seems that this is being used to some extent to talk about the crime problem, the immigration problem. But when you look at opioids, I mean, it goes farther than that. This is a problem that, in some respects, started right here on American soil.
I think that's exactly right. He likes to draw a direct line from opioids to immigration to crime, like exactly like you said. But the facts are that crime remains at or near record lows. Even Jeff Sessions acknowledges that the crime rate likely fell in 2017. So it doesn't seem like there's any real connection between opioids and crime. Aside from that, the connection between immigration and the opioid crisis is a little more tendentious, like you say. A lot of people, around 50% in research we've done and research that we've analyzed, get hooked based on pills they get from a friend or a family member, pills that have been legally prescribed to them. Well, that's not something you can control with a wall.
No, and I think what you mentioned, that's a good point, because I go back to, and we're talking 8 or 9 years ago, I had knee surgery, and I got I got prescribed so many OxyContin pills. I mean, I'm like, what the hell am I going to do with all of these? I never use them all, but it just goes to the fact that that's what we're seeing with pharmaceutical companies. We're seeing, I mean, it was very easy and very accessible to get them for a long while.
Yeah, and actually the one good thing I'll say about the Sessions and Trump response to this is they've talked a little bit about increasing penalties for companies that flout manufacturing regulations and that pump more pills into the country. I think that's a welcome step forward.
Yeah.
There's also some state laws that limit how many pills you can get on a first prescription, so you won't have a problem like yours. I think that's a promising step.
Ames, have about 30 seconds left. If you were advising this administration on how to best move ahead, what would you say?
So this is controversial, but I'd start with don't cut the social safety net. There was an analysis by HHS that found that if you cut the Affordable Care Act, the uninsured rate would triple in states like West Virginia that have been really hard hit by the crisis, and those people couldn't afford substance abuse treatment anymore. I'd start with making sure that people like that get good health care and can actually deal with addiction on their own.
Ames Grawert, I appreciate your perspective tonight. Thanks for joining us.
Thank you for having me.
We're back after this in the Final Five.
In a dark seesaw, please follow the leader. So Eric B. We are microphone fiend. It's the return of